I'm your host, Catherine McQueen, and tonight we have as our special guest Dr. Tammaji Kulkarni. He is the Vice President of Medical Affairs for WELLCARE Health Plans and Harmony Health Plan Incorporated. Good evening, Dr. Kulkarni.
Good evening, Catherine.
Now, I'm going to give the audience a little background history and your bio in regards to your medical profession. Dr. Kulkarni, as a physician executive and currently Vice President of Medical Affairs with Harmony Health Plan and WELLCARE Health Plan Incorporated, sharing 25 years of clinical experience and 15 years of progressive management responsibilities in a variety of healthcare settings. Dr. Tammaji Kulkarni has special expertise with regard to a diverse clinical practice in clinical care, quality, utilization management, pharmacy risk management, disease management, program development, quality improvement, contract negotiations, and budget management. That's a very extensive background.
Thank you, Catherine.
So tell me, what would you like the viewing audience to know if we talked a little bit more about your background history? What would you like to add to your career summary?
Sure. I'm a board-certified general internist, and I have had practice in various settings, like you mentioned. I have been in a solo private practice. I have seen patients in a group practice setting. I have worked for insurance companies, and I worked for physician groups, and now I'm with Harmony Health Plan for the last 5 years.
I want to touch a little bit on and highlight your certifications and memberships. He holds several degrees, including Bachelor of Medicine, Bachelor of Surgery, American Board of Internal Medicine, Quality Assurance and Utilization Review, and American Board of Medical Management, correct?
Correct.
And you were a former member of the American College of Physician Executives and the American College of Physicians, is that correct?
That's correct.
Okay, now, Dr. Kulkarni, can you tell us, may I call you Dr. K?
Sure, that's easier.
So to the viewing audience now, we're going to be calling Dr. Kulkarni Dr. K. Now, Dr. K, can you tell us, give us some information about what's going on with the new federal programs ensuring affordable health care coverage?
Sure. Especially in the state of Illinois, Honorable Governor 𝒥𝑜𝒽𝓃 has put in a lot of efforts and money into improving access to care for people who don't have insurance or who are underinsured. Governor 𝒥𝑜𝒽𝓃 has started All Kids program, as you all know, and also he is thinking of providing coverage for every Illinois citizen. There are so many Illinois citizens who don't have insurance right now, and governor is working with the Senate and the House to pass a bill to provide coverage for everybody in Illinois.
In other words, would that be targeted to one age range, or would it cover seniors as well?
Yes, it's all age group. It's all age group. Anybody and everybody who has no insurance, he wants to come up with a program and funding for it to cover everybody.
So now, has the bill been sent to the Senate yet?
Actually, there was a modified version of the bill was sent. He wanted to, of course, first you had to fund that program, right, to pay for the program. I don't think the initial version of it got passed in the Senate or the House. There is some opposition to it. However, governor is working with the Senate and the House to make this a reality.
Now tell me something, since they're trying to pass a bill for affordable health care in Illinois for everyone, and everybody needs to be covered by some type of insurance, what does that mean? I know what's going to happen is people are going to be looking at health plans and they're not going to understand them. Can you give the viewing audience some type of information so they can understand the health plan?
Sure. I can specifically address the Medicare part of it. As you all know, the federal government provides Medicare insurance. However, there are many health plans in the state and throughout the country that have contracts with the feds, federal government, or the CMS. That's the agency that oversees the Medicare administration. These health plans have agreements with the federal government, and they provide a comprehensive care to Medicare enrollees. The advantages are, they coordinate care much better than in the fee-for-service world, in my opinion. So people have to be cognizant of the fact that there are other options available in the market in addition to straight fee-for-service.
I see. I see. Now, tell me something. Why is there a need for everybody to be under an insurance plan and to also have health insurance coverage? Why is there a need for it to be mandatory?
Sure. The reason is, we all have medical problems, especially when the aging population has more medical problems. And everybody has to have insurance. Otherwise, people, number one, won't have access to care, people who don't have insurance.
Okay.
And they will wait when the problems are little, and they end up in the emergency room. Problems are too late to take care of. For example, if it's a cancer, it's better if you detect it early and treat it. The outcomes are much better rather than when it has spread all over the system, the outcome is poor.
I see.
So it also applies to all preventive health care too. For example, for children immunization, and in adults mammography, pap smear, and all of these preventive services are provided earlier and quicker if you have insurance versus if you don't have insurance.
And would that be more cost effective as well? Because by that what I mean is if people wait too long, it's going to cost more to take care of them when they become sicker.
That's right, absolutely. In fact, the society will pay for it ultimately. If people don't have insurance,
yes,
they end up in the hospitals, and the hospitals, are funded by the state, and by the federal government, or by the taxes that we all pay. So ultimately, the society pays one way or the other. So the thinking of providing universal care is that let's provide that care up front, so it is going to be cost effective and we can prevent certain diseases and diagnose them and treat them much earlier in the process.
Okay, so now we know that they're going to try to pass the bill where health care is mandatory. What should the viewing audience be looking for, and what should people be looking for when they enroll in a health plan?
Currently, the way the health plans are available to the community, especially the Medicare enrollees, when you want to choose a health plan, you want to look at first what is covered. Most of these plans are instead of Medicare. So first you need to understand you cannot have a fee-for-service Medicare and have a Medicare HMO or the Medicare health plan. You can have one or the other. You can't have both.
I see.
So first they need to understand it is in lieu of Medicare you are choosing a health plan. And when you choose a health plan, you want to look for your doctor. If you already have a doctor, make sure he or she is in that network.
I see.
So when you want to look for a health plan, you want to make sure first it is instead of Medicare. Number two, you make sure the doctor you are currently seeing or you have a relationship with the doctor, he or she is in the network. And third thing is to make sure your hospital is in the network that you normally use.
Yes.
And fourth thing is, you make sure what is covered, because there are a lot of variations. Even though all health plans are supposed to cover at a minimum what is covered under Medicare.
I see.
In addition to that, they have some extra benefits they provide you. And you may want to compare different plans and see, which HMO or health plan gives extra benefits that are beneficial to you.
I see. So then, in other words, say for instance, I might be already in a health plan already, but say for instance, if my mother, say she's a senior, and I wanted to look for a health plan for her, okay, the things that I need to look for is this health plan that I'm looking into, is her doctor in that network already? And if not, then I need to look for a health plan that has doctors that will cover what her illness is.
That's correct. It also applies to the primary care doctor,
yes,
and also the specialist.
I see.
You may want to make sure, whoever doctor you feel comfortable with or you have a relationship with are within your network.
Now tell me, what about the benefits and the co-payments when we deal with health plans?
That's very important too. Before you choose the health plan, you want to look at what are the fee structures. For example, some health plans charge you a copay when you go and see the doctor, If you see the primary care doctor, they may charge you $10 per visit. Or if you go to a specialist, they may charge you $25, $30 per visit. And some health plans may not charge you anything.
I see.
So you need to compare that and see, how different plans compare.
So then what will happen is you're looking at that too to fit your budget.
That's correct.
And your needs.
That's correct.
All right. All right. Now, in regards to the doctor's visits and hospitalization, what do you need to look for in a health plan?
Same thing. You make sure the physicians and the hospitals you want to go to are in your network. And again, there are the co-pays and deductibles. You need to understand those. For example, even when you get admitted, some plans have a deductible, meaning you have to pay the first $80 or $100 of the hospital bill. The health plans tell you up front, let's say you need a hospitalization in the future.
Okay.
Right? But you need to know some hospitals charge you per day X amount of dollars that comes from your pocket.
Oh.
And some health plans charge you $0. And so on and so forth. And you also need to know how much you pay monthly to be in that plan. That's called the premium.
I see.
That varies too by health plan to health plan.
I see.
So also, after looking at these individual items, you need to look at a bigger picture. Overall, depending on your medical condition, depending on your physical status, which plan works better for you.
I see.
Because some plans work better if you are a healthy senior.
I see.
Versus some plans work better if you are a senior with a lot of medical problems. So you need to compare those in that aspect.
I see. All right. Now, in regards to the cost for prescription drugs, how is the healthcare coverage going to take care of that situation?
Yes. The pharmaceuticals are one of the biggest expenses of healthcare.
I see.
And the pharmaceutical cost is going up rapidly over the years. In some cases, it is up to 1/3 of the medical cost we spend in healthcare. Anyway, so it's very important. In the past, Medicare enrollees had to pay from their own pocket to get medications. President Bush and the Congress, they passed this plan called PDP, Prescription Drug Program.
Yes.
Or it's also known as Part D, D as in David. So that plan has made it a little bit more affordable for seniors to pay for their medications. Again, in the PDP, Prescription Drug Programs, there are several of them.
Yes.
You have to look and see which one meets your needs. And every one of them covers generic medications.
Generic.
Now, if you are on some branded medications or brand medications, they will ask you to pay some extra money, maybe $20, some plans $50, some plans $60 for a month's supply.
Yes.
So you need to compare and contrast depending on your clinical situation, because some of you may not be on any medication. Some of you may be on 10 medications.
Yes.
And of those 10 medications, maybe 8 of them could be generic you are taking, or could be 7 of them could be brand. So you need to look at all of that. The best thing is you need to sit down with your physician and explain to him or her that you are thinking of choosing a PDP program, whether he has any suggestions or she has any suggestions for you. And also, this is an opportunity for you to talk to your physicians to see if you can switch some of the brand medications into generic medication. Because generic medications are equally effective and efficacious as brand medications. I firmly believe that, most diseases could be treated with generic medications.
I see.
However, there are situations where there are no generic equivalents, then, you have to use the branded medications. But the best person to help you is your physician, he or she can help you.
So then what a person needs to really take advantage of is when they're in their doctor's office, they need to kind of map out what they need to say to that physician in regards to taking that medication.
Absolutely.
So now tell me something I know as a younger person, I'll be able to understand my medications and prescriptions, but what do you see is going on with the seniors and them taking medications and getting prescriptions filled?
Yeah, it is a challenge in the senior population. When I was practicing at Michael Reese Health Plan, which was a staff model HMO, I have had seniors come to me. Literally they were on 10 or 12 medications.
Yes.
And they had to choose which one to take because they couldn't afford all 10 medications.
I see.
So it is a big problem, especially in a low-income senior population. So they need to understand, generally, they need to understand generic medications are equally good by and large.
Yes.
There are some exceptions. There you may want to use brand medications. But you need to take the opportunity of talking to your physician at every visit and talk to him or her and ask them questions. Again, I'm on these medications. First of all, do I need all these medications? Maybe I don't need 2 or 3 of these. So take the list to your doctor and ask her or him to see if we can eliminate some of these or decrease the doses of some of these medications. And third thing is maybe to switch some of these to generic medication.
And then probably map out a plan that over a course of, a few months, well, we're going to take you off of this one, we're going to wean you off of that one. So tell us what's happening in the underserved communities.
As we all know, in the underserved communities, there are 2 or 3 things happening. Number one, the access is an issue. Access in the sense they can't go and see the doctor when they need to.
I see.
So what they do, they either wait for too long before the little problem becomes a big problem, or they end up in the emergency room.
I see.
Now, if they go to the emergency room, that's not the best place to get your routine care, because emergency rooms are especially meant for people who are really ill and have life-threatening illnesses.
Yes.
When people show up there with sore throat or a little urinary tract infection,
yeah,
that backs up. For example, if somebody has acute heart attack, acute MI we call heart attack,
yeah,
they need to be taken care of first. So number one, you end up waiting in the emergency room before you are seen. So the best thing is, you need to go and see your doctor. But it is true, in an underserved community, because they don't have insurance, they don't have access to go see the doctor in his or her office.
So then the universal health plan will help those people be able to go to see the doctor when they first start experiencing problems.
That's correct. Sooner the better. Even you need to go and see the doctor even if you don't have problems.
I
see.
See.
That's the preventive care,
okay,
right? They need to check you maybe once a year or so. Make sure your sugar is okay, your blood pressure is okay, especially when you're a senior. They need to check you even if you don't have any symptoms, because some of these diseases don't even have symptoms. Good example is high blood pressure. Many patients with high blood pressure don't have any symptoms. So you have to go and get your routine checks with your doctors, even if you don't have symptoms. If you have insurance, that makes it easy.
I see. So now, the underserved communities, that would be like communities where there really aren't too many doctors around. Is that it?
That's correct. Not too many doctors, or not even offices or hospitals. Even if there are doctors, they may not accept like Medicaid or Medicare in some locations. But in most regions they do. But in some areas, especially in the specialty care, there is some problem. Sometimes it is difficult to get an appointment with a specialist if you have Medicaid or Medicare in some areas.
I see. So the health care situation is in the African American community.
I think we touched upon it briefly, on African American communities, kind of underserved communities as well. So, it is a challenge. There is no access, meaning they can't get appointments when they need. And even, when they get appointment, sometimes, all the testing may not be done because
yes,
you don't have insurance, right?
Yes.
So people hesitate to prescribe all these testings that are needed for 2 reasons. One, you may end up paying for it from your pocket as a patient.
Yes.
And that is going to be very expensive for all these tests. So the doctors have to think of 3 tests, which one is the cheapest, and gives you the best information.
So they have to, so he has to think of a test that you can afford that may help you.
I mean, if you have insurance, insurance covers most tests. I mean, we have to order the tests only when they are medically necessary.
Yes.
But, sometimes there may be 3 tests medically necessary. But then, you may want to choose one over the other, see how this test comes out. Depending on the result, you may want to order the next test.
I see.
But, a prudent physician, they already, do this in their brain. They figure out which one they need to look at first. Most physicians do that.
I see. Now, Dr. Kulkarni, tell me something. Say, for instance, we talk about the baby boomers, and now we're seeing more baby boomers taking care of their elderly parents. What do they need to look for in a health plan?
Okay. First of all, the fortunate thing is many baby boomers are better educated and financially somewhat better off. And they are very savvy in finding information on internet or in the library. So my recommendation would be, they need to find out more information, compare and contrast different plans and different insurance options they have for their loved ones, elderly loved ones. And then they need to choose some of these plans which may have some additional benefits to give to their loved ones. Maybe they may want to choose those, so that'll put less burden on them or help them take care of their loved ones.
I see. Now, getting back to other underserved and disadvantaged minorities, what's going on in the Latino community?
It's the same thing. Latino community, again, there is no access, there is no insurance coverage for many of these members of the community. And secondly, it's not only in Latin community, somewhat in African American community too, and in some other ethnic communities, there is another factor we're missing, that's cultural aspects. For example, in certain community, a woman will not go and get a mammogram done because she doesn't want to expose her breast to the X-ray machine or anybody else. I think some of this cultural thing in Latino community is also there. They don't, some people feel culturally inhibited to get a pap smear, for example,
I see.
or a mammography, or being examined by a male doctor, those kind of things.
I never would have thought about that it has something to do with culture. For the most part, a lot of times we think that it's more so people are afraid to find out if they have a lump or if something is going to show up on.
Actually, in some cultures, they don't show their breasts, or they don't want anybody to do a pap smear.
So then they would need someone to explain to educate them and explain the importance of that pap smear or the breast exam. Right, now let me ask you another question. We were talking about preventive care versus pre-preventive care. Can you give the viewing audience a little information on that?
Sure. Preventive care is basically to make sure we prevent diseases from coming on us, for example. But it's not always easy. As we get older and older, we'll be exposed to the aging process, and we will have certain diseases or conditions. Now, what is pre-preventive care? Well, actually, what is pre-preventive care, in my opinion, is basically staying healthy.
I see.
So you have good habits, like daily exercise, maybe 20 to 30 minutes a day, and healthy eating, like vegetables and high fiber and no fat or less fat, and no smoking. Importantly, no smoking. And so these are all healthy life habits. Those kind of help you to stay healthier and prevent or postpone some of the things that come along with aging.
For instance, let's talk about heart disease. So
actually, the heart disease is a little tricky. A lot depends on the genetics.
I see.
It depends on your family history. But for example, other things, for example, being obese, right? Being obese will expose you to developing diabetes later.
Okay.
So the best thing there is to lose weight and avoid too many, sugar and high-fat diet and exercise and smoking. Again, I'm stressing smoking again and again. Smoking does a lot of damage. So please don't start if you haven't started smoking. If you're already a smoker, please quit as soon as you can.
Okay.
Smoking will help you, stopping smoking will help you the most. But staying healthy, basically eating right food, you know, those kind of things will keep you healthier for a longer time period.
I see. So in other words, then, if I was under a health plan and I knew diabetes or heart disease or hypertension runs in my family, I can go into the doctor's office and say, I want to sit down and talk about pre-preventive health care so that I, for the most part, won't develop
in that
these
case,
illnesses.
Yeah, the kind of things you know, one would recommend is an exercise program, for example. A physician can design an exercise program for you. And also maybe they can help you on a diet and can tell you how many calories should come from fat, protein, carbohydrate, how much fiber you have to eat, you know, those kind of things they can help you. And also sometimes relaxation helps too. So, you know, some plans cover certain types of relaxation techniques and some exercise programs and even education, just simple education. For example, diabetes education. You know, plans cover diabetes education because not everybody understands what diabetes is.
And they need to know that.
Yes, and how, you know, it comes to you once you start getting a little older and once you start gaining weight, you know, you're more exposed to it, especially if you have a family history. You know, those kind of things, you know, you can plan and discuss with your physician.
So then if they get enrolled into a good health plan, then what will happen is if they have the education, let's take for instance of diabetes, then what will happen is they have the education, they can see the signs, and they can get on them right away. I see.
You're right.
Okay. All right. So now getting back to senior health care and medication coverage, what's the difference? First of all, what would we consider a senior and what would we consider a person who is not a senior yet, as far as would their medical coverage for prescriptions be different?
Yes, you know, generally the Medicare covers everybody who is 65 or above.
Okay.
That is called a senior, 65 and above.
Okay.
And when you turn 65,
yes,
right away we get Medicare coverage.
Okay.
Of course, you have to apply for that and fill all the paperwork, but you will be eligible for Medicare.
But now what about our prescriptions? Will they be free or will we pay a cost?
Okay. Again, once I'm 65, let's say, you will have options. There are like 40 different plans that have prescription coverage program. So we need to pick and choose from those.
I see.
Which one will suit your need, basically. Now, that's people who are 65. But there are many people who are under 65 will also will be covered by Medicare, provided they have some disabling medical conditions. Then they're also covered under Medicare. I
see. So now, when everybody is under a health plan, what is this going to do for the community?
I think, as I mentioned earlier, you know, ultimately the community will pay for everybody's health care, whether they're insured or not, especially for the uninsured, right? So if everybody has insurance, again, in my opinion, you know, that will, number one, encourage people to be healthy.
Yes.
And be practicing healthy lifestyles. And then we can identify diseases very early.
Yes.
And treat them appropriately in a timely manner. Yeah, whether it's inpatient or outpatient, they will, you know, all be exposed to availability. When they will have availability of all these services, I think for the community, it is good. Overall, it's good.
It'll be a good thing.
Yes.
Okay. So now and then with prescriptions, if everybody is able to have medication, what is this going to mean overall for the community?
Same thing again. Yeah, I think it's good for the community because if you diagnose the disease, you can treat it early. And many diseases, as you all know, are treated with medication.
Yes.
So if they can't afford the medication, you know, they won't take it, and they will end up with complications, end up in the hospital. That'll cost the community as a whole much more money.
So it'll cost the community more as a whole.
Yes. Number one, to take care of the problems. Number two, from loss of work, loss of productivity from that person.
I see.
So overall, the community loses if people don't have insurance or don't have prescription coverage.
Okay. All right. We'll be back in a moment. Now, Dr. K, let's talk about health conditions. Can you explain to the viewing audience the difference between acute and chronic health conditions?
Sure. Acute condition is something that starts in a few days and few hours. Chronic is something somebody has for several months to several years. For example, chest pain. If somebody gets a chest pain, that's called acute. If they never had it and you suddenly get a chest pain, or even shortness of breath, if they never had it and they suddenly can't breathe, that is acute.
I see.
Now, on the other hand, the chronic example is diabetes, right? If somebody has diabetes for 10 years, that's a chronic condition. Or a backache. Many people have backache for several years. That is, chronic condition. On the other hand, somebody, tries to lift something and their back goes out. That's acute back pain too.
Mm-hmm.
But if they had this chronic, nagging back pain for years and months, that's chronic.
I see. Now, Dr. K, what do you think? Do you see that the diseases are rising at an alarming rate?
Yes, there are few diseases, well, there are many actually. The ones that come to my mind are diabetes, asthma, and heart disease.
I see.
And high blood pressure.
Mm-hmm.
And these conditions are rampant in the community. I think a lot of it is to do with we are better now at diagnosing them, and also the stresses and strains of this modern life we're living in.
Yes.
So that kind of adds to all of these, especially for high blood pressure. Now, asthma, asthma is the pollution and the poor air quality, all of that, especially in the inner city neighborhood.
Mm-hmm.
There is an increase in the asthma attack rates.
It is?
Yes.
Oh, I see.
Increasing.
So now, what do you think could be implemented to help to lower the diseases that we see that are rising at an alarming rate?
Okay. For asthma, I can say several things. One, the poor air quality I mentioned.
Mm-hmm.
The less pollution, it's better.
I see.
So as you all know, there is a global problem with pollution,
Mm-hmm.
And many people are working on it to reduce the emissions, toxic emissions, gases, and so on and so forth. Now, what we can do in the community is, another pollutant is smoke, basically, So smoking is another important thing. We need to cut down the smoking in the community,
Mm-hmm.
and decrease our exposure to community, especially children, shouldn't be exposed to secondhand smoking.
I see.
That all will, increase the incidence of asthma.
So in other words, then, if we work within ourselves to do certain things like cut down on smoking or stop smoking, then that, for the most part, will reduce the that in the atmosphere.
To some extent, yes.
And
but again, many of this pollution is from factories
Mm-hmm.
and cars,
Oh.
car emissions,
Mm-hmm.
and all of these. So we really need to work as a society in cooperation with the governments to make this happen.
I see. Okay, now tell us, what would we be able to do in regards to heart disease and
Chronic
strokes?
diseases.
Yes.
These chronic diseases like heart disease and hypertension, high blood pressure, and diabetes.
Mm-hmm.
There, the trick is to stay healthy as much as possible. So, if somebody is a little obese, they will eventually get type 2 diabetes.
Oh, I see.
So it's better to lose weight and eat right and exercise.
Mm-hmm.
So you can stay healthy for a longer time of period. So the key is practicing healthy lifestyles.
Yes.
And also to get periodic checks with your doctor. Make sure, even though you don't have symptoms, you make sure, check your blood pressure and make sure you don't have high blood pressure. Also screen for diabetes. Many times you don't have any symptoms even if you have diabetes.
So in other words, then, the mandatory health plan would afford people who are trying to get healthy the ability to go to the doctor so that they can stay healthy.
Absolutely. It will enable these members who have insurance
Mm-hmm.
to have better access to health care
Mm-hmm.
and go and seek these preventive and screening services.
I see. And then better health care means better communities.
That's absolutely.
Healthy communities, right?
Healthy community, you're right.
Okay. So now let's talk about control and management and pre-preventive methods that people can look into.
Basically, once again, I'll go back to this. Eating right, exercise, not smoking, and going to your doctor, getting the testing done, screening done, and once something is diagnosed, something is prescribed, sticking to the regimen that is
sticking to the regimen
recommended by your doctor.
Mm-hmm.
I know sometimes it is hard, even as in the medical community. If somebody asks you to take medication 4 times a day, it's not easy to take 4 times a day. It's a lot easier to take once a day,
mm-hmm.
or one tablet every other day.
Mm-hmm.
But even then, you need to stick to the regimen your doctor has prescribed for that particular, the condition, whether it is diet or exercise or medication.
So then if a person knows that they have problems taking medication, would it be better for them to let the doctor know that? So especially some people even have a problem swallowing pills.
Yes. You need to right away let your doctor know, because there are other forms of medications. For example, if a person cannot swallow a tablet,
yes.
we can give them liquid,
mm-hmm.
or some other form,
mm-hmm.
injection or inhalation. There are various other modes of giving the medication. So best thing is you need to talk to your doctor, let them know right away, I can't swallow this, or I can't take this medicine 5 times a day. Could you, give me something that I can take once a day?
Mm-hmm. So you mean they have medications that you could possibly inhale?
Oh yeah. For example, for asthma, we have inhaled medications.
Mm-hmm.
Actually, yeah, there are medications for certain conditions you could inhale. Yes.
I see. Okay. Again, what we're dealing with now is trying to lower the alarming rate of the diseases, correct?
That's correct.
All right, so then what can we do when we look at early signs and symptoms?
The best thing is, as soon as you have symptoms, best person would be your doctor. Please
mm-hmm.
go to your doctor, make an appointment, discuss with him or her. It could be headache, or it could be whatever, bleeding gum or whatever it is. You never had it before, and you suddenly have this symptom now.
Oh.
And then, you call your doctor and make an appointment and discuss, these symptoms. Some of these symptoms sometimes are very trivial, meaning, they're not that important. Everybody gets some aches and pains here and there, they go away. But sometimes, these early symptoms could be warning us of some, major problem.
I see. So what we need to look for is signs of things that we haven't been experiencing in the past.
Mm-hmm.
Okay. All right. So, and then too, just to let the viewing audience know, we're going to have Dr. K back periodically, and we're going to touch or give more in-depth information on different and specific diseases.
Sure.
Okay. And now we're going to talk about the healthcare providers and payments for physicians and the doctors, correct?
Sure.
Now, what's going on there? Because if a lot of people have to pay out of their pockets, what's happening?
Yeah, it's a problem. Physicians, I was a practicing physician before. You need to understand physicians are very busy, as you may have noticed. They have many patients to be seen.
Mm-hmm.
They don't have much time on many occasions, and they have to deal with multiple insurance companies.
Mm-hmm.
They all have different rules. So it is taxing. It is hard on doctors sometimes to pay attention to all your problems. So I used to have patients, they would come with a list of 20 problems, and to fix them all in 15 minutes.
You can't.
You can't do that.
Yeah.
So you need to work with your doctor,
mm-hmm.
and take maybe the top 2 or 3 problems that are bothering you now.
I see.
And ask your doctor, this is one I want to talk to you about.
Mm-hmm.
And then, doctor will figure it out. He or she will, after checking your symptoms and signs and examining, you will figure out, and they prioritize what needs to be done. And they may bring you back within 2 weeks, or give you an appointment for a complete physical exam.
I see.
Things like that.
In other words, it would be better when people are covered under this mandatory health plan, it would be better for them first to just start off with just regular checkups.
That's correct. Absolutely. With a regular checkup, your doctor will identify whatever you need,
mm-hmm.
and will bring you back, depending on the severity of the condition.
I see. So and then we should not get offended that the doctor comes in and may have to go out and he can't stay that long. It is because of his practice, who he's the patient care that he has to give. And what happens is we need to come up with a better way to utilize our time once we get into his office, correct?
That's correct. What I would recommend is, we should be more aggressive in seeking health care. You all, I mean. So you need to prepare before you go to the doctor's appointment. Talk about, what kind of things that are bothering you, what kind of medications you are going to talk about. So be prepared, and that will really help your doctor too. You can say, these are the medications I'm on. I want to talk to you about these two which are bothering me. And these are the 2 complaints I have today. I want you to help me sort it out. That will help the doctor too.
Okay. So then, in other words, because the physician is very busy and his time is limited, we need to do what?
Need to do the homework, basically, right?
Oh, so we need to do some homework.
You need to do homework. There is no excuse for the doctors either not to give full attention.
I see.
If you have 30-minute appointment, it doesn't matter. Sometimes I had 15-minute appointment. I spend 1.5 hours, 1 hour 15 minutes on that patient.
I see.
So depending on the condition situation, you will spend more time. Doctors do that too. They don't say your time is up, move on. Generally, they care of you.
Okay.
But it'll help, if you do some of your homework, and really, you need to work as a team.
Okay.
Because the doctor and the patient are one team.
I see.
And both are working toward, improving your health care.
I see.
And you need to take full ownership of that too. And work with your doctor. You work as a team and come up with a plan to improve your health.
So in other words, don't put all the emphasis on the doctor. It has to be part of us as well.
That's right.
Okay, and work as a team.
That's right.
All right. All right, then. So now what we want to talk to, too, is about doctors' fees. Now, under health plans, is the doctor paid so much?
Okay, there are many different arrangements health plans have with different doctors and doctors groups.
Okay.
For some groups, they have capitation. What is known as capitation? That means they pay the physician upfront every month at the beginning of the month X amount of dollars per member. And the doctor is responsible for providing all the type of care that member needs. In some other settings, they pay fee for service. For example, per visit, they pay the Medicare fee scale. Whatever Medicare pays, they would pay that.
I see.
So it's called fee for service. So there are 2-3 different arrangements health plans have with their doctors.
But when they're paying that fee, when Medicare is paying that fee, is that also limiting your time? In other words, if they're saying, okay, we're going to pay $40 or $50 a visit, so you need to, keep that visit to maybe a half an hour tops, or?
Okay, actually, Medicare is not prescriptive on that.
Okay.
And even physicians should not be focusing too much on the time they spend. All physicians have taken the oath, right, to provide care and take care of the members.
Yes.
Take care of the patient. So they need to spend the time they feel is necessary to take care of the problem. So it could be 10 minutes, it could be 1 hour. Whatever it takes, they need to spend. But it's true, when you're so busy, sometimes it's not always that way. But it'll help if you work as a team with your doctor.
I see. So now let's talk about hospitalization. All right. Now, even though now we're going to be covered under the health plans, is it better to be concerned about being in the hospital and long hospital stays?
Yes. I believe that, hospital is not a good place to be in unless you're sick.
Okay.
Because hospitalization itself brings some problems. To give you an example, there are a lot of medication errors in the hospital that happen, and then there are, procedure errors that happen, and most importantly, infections.
I see.
If you stay unnecessarily in the hospital, you're exposed to more infections, possibility of catching more infections. I mean, hospitals are good places. When you are sick, you need something to be done. So I believe not being admitted to the hospital when you don't need to be admitted to the hospital. If something could be done in your home and in the doctor's office, that is a healthier setting to get that service rather than being in the hospital.
Okay, so now tell me something. Now, you had experienced a problem before with one of your sons being ill, is that correct?
That's correct. I have only one son and one daughter. But yes, this was, I think my son was 5 years old or 6 years old. He had pneumonia.
Yes.
And his pediatrician wanted to admit him to the hospital. And I mean, I could do it because I'm a physician, so I knew what was going on. I don't think lay people should do this. I knew that my son has pneumonia. All he needed was some antibiotic. And I talked to the physician. I said, I will take him home. I'll give him some antibiotic through his mouth.
I see.
If he keeps it down, then, if his fever comes down, then, he's fine. He doesn't need to be in the hospital. On the other hand, if he doesn't keep his medicine down, if his fever stays high, then I'll take him to the hospital. So, the pediatrician was a little reluctant to let me do that. But then he understood, I'm a physician, so I can keep a close watch on my son. I was able to do that. So I avoided a hospitalization, even though my insurance would have covered it.
I see.
But I felt that, I could have managed it at my home rather than in the hospital.
So then would you suggest that something like that to other people?
Again, I wouldn't suggest that, blindly to everybody.
Yes.
But you just talk to your physician again. Does it have to be in the hospital? Or is there another alternative setting where, this could be done?
Okay. So in other words, a mature person, maybe a mother and a child, or a person taking care of a senior, they need to ask those questions and see, is it something that can be done at home? Let's talk about hospital fees versus surgeon fees.
Okay. Many times, people don't realize that the insurance pays the hospital bills, and surgeons who do surgery in the hospitals, they send a separate bill. Many times, people think that it's all covered under the hospital bill.
But it's not.
It is not, because the surgeons, they're independent practicing physicians. So, they send a separate bill. Usually, when you have insurance, the insurance covers both.
I see.
The surgeon's bill and also the hospital bill. But, when you receive the bill, all members receive the bill too. The bill says one is coming from the hospital stay, another one is coming from the surgeon.
Yes.
Shouldn't be surprised. Your insurance should take care of both of them.
So then, in other words, then people should look for a health plan coverage that will take care of the both. Is that what you're saying?
That's correct. But all insurance plans cover both.
Okay. So now let's talk about misaligned incentives.
Okay. I mean, this is, it's my opinion in the industry that the incentives in the healthcare industry are misaligned, in the sense the physicians have certain incentives, the hospitals have certain incentives, pharmaceutical companies have certain incentives, home health care agencies have certain incentives. They are not aligned, in the sense if somebody wants to improve their bottom line, they want to do certain things that hurts some other segments of the healthcare industry.
So is it like a circle or a pyramid? Is that it?
How should I say it? It's not conducive to work as a team.
I see.
All these subcomponents of the healthcare industry, because for generally, if somebody stays in the hospital 10 days versus 5 days, the hospital gets more money, right? On the other hand, the health plans, the Medicare, the insurance companies, they don't want patients to stay in the hospital unnecessarily.
I see.
So, that is in conflict with the hospital's interest.
I see.
Right? And many times, the doctors, they may work hard and send the patient home as early as possible, as early as medically feasible, but then, they won't get any extra money for that. The insurance company may benefit from it.
I see.
So, I mean, in general, the incentives throughout the industry and the sub-segments of the industry are not very conducive to work together.
And so, and that's what we need in order to provide the communities with better health care.
In my opinion, yes.
Okay, now let's talk about 𝒥𝑜𝒽𝓃,
Yes.
and that's the Joint Commission of Accreditation of Healthcare Organizations.
That's correct. 𝒥𝑜𝒽𝓃, what it does is it goes around the country and checks all hospitals
I see.
and healthcare organizations and gives them a pass or fail certificate
Oh,
based on what they do.
so the hospitals have to receive a report card.
That's correct.
Okay.
The report card, they give you this good seal of approval, you know.
Okay.
What is it called? Housekeeping good seal of
Yeah,
approval.
yes.
Like that. So JCHO goes around, it passes, fails, and grades all hospitals in the country. So you need to look for a hospital that has 𝒥𝑜𝒽𝓃 accreditation and has an A grade or a better score.
I see.
Because they check out various things that happen in the hospital,
Uh-huh.
and based on that, they decided this hospital provides good care.
Okay, so viewing audience, remember now the hospitals are given a report card as well, right?
Yes.
Okay, and one more thing, and we're going to wrap this up. Tell us a little bit about the National Commission for Quality Assurance.
Okay, it's NCQA, it is called. That's National Commission for Quality Assurance.
Yes.
Actually, I'm a surveyor for that organization.
Yes.
Again, this is a non-for-profit organization. It goes around the country and checks the health plans and
Okay.
the HMOs.
Yes.
And passes them and fails them and gives them report card.
I see. Are there websites that people can look on and find out these accreditations?
Yes, you can log on to ncqa.com or 𝒥𝑜𝒽𝓃.com. There's more information on that about those.
All right. Thank you so much, Dr. K. And we will certainly have you back soon. And I want to thank you so much. And again, this is Catherine McQueen, your host for CommerceConnections.tv.
Thank you.